Hello, this is Dr. David Green, Educational Director for Premier Pain Specialists in Chicago. Today's topic is what you need to know about epidural injections. An epidural injection is an outpatient procedure involving steroid and numbing medicine into the epidural space. It's designed to relieve the pain from pinched nerves that are having sciatica or radiculopathy. The epidural space is the area around the spinal cord where the nerve roots come off. Keep in mind the injection does not go into the spinal cord or into the nerve roots. The indications for an epidural injection, there are a few. Herniated disc with radiculopathy or sciatica, means it's in the neck or the low back or the mid back as well. Spinal stenosis is a great indication. You can have inflamed nerve roots due to degenerative disc disease. This can cause a tear in the outer part of the disc known as an annular tear. Also, compression fractures, which are often due to osteoporosis, can irritate adjacent nerve roots and be an excellent indication for an epidural. There's three different types of epidural injections. The first is interlaminar epidural injection. These have been done since the 1950s, so over 60 years. And basically, what happens is the needle is going between the lamina, here and here, interlaminar, okay? There's some soft tissue that the pain doctor will go through, and then once through that, they're in the epidural space, okay? The second type is the newest type of epidural injection. It's called a transforaminal epidural. So the needle before was over here, right? You have the lamina, interlaminar. This one, it goes on the outside because a nerve root, as they come out through this hole called the foramen, there's another one here called the foramen. Most of the time, the disc is being compressed right here, okay? So the better way to do it is to put the steroid and numbing medicine through the transforaminal area, and that's been shown to provide excellent pain relief. The third type is called a caudal epidural injection. Here's the low back, sacrum. This is called the sacral hiatus. That is where the medication is injected for a caudal epidural injection, okay? A larger amount is injected than with the other two types, and it will migrate up, and it can provide pain relief for several areas, which is great for spinal stenosis, where potentially multiple nerve roots are being pinched. These injections, all of them, may need to be given as a series. A lot of pain doctors will do a series of 3 over 6 weeks, okay? And that can give excellent pain relief. How are these injections performed? They're outpatient, takes about half an hour. Local numbing is pretty much always given. Sometimes sedation is administered. Modern pain doctors will use real-time x-ray with a machine that looks like this, looks like a big C. So people call it a C-arm or fluoroscopy. For interlaminar, the technique is loss of resistance. As you put the needle through the soft tissue, as it gets through, you feel a loss of resistance. And the pain doctor will typically inject dye with any of the methods to make sure they're happy with the location of the needle before injecting the steroid and the numbing medicine. Patients go home the same day, usually within about an hour afterwards. How well do they work? There have been dozens of studies looking at epidural injections. Overall, 75 to 90% good to excellent results with the procedure. As I mentioned, the patient may need a series of 3 injections over a 6-week period for maximum benefit. The numbing medicine usually kicks in immediately, and then it may take the steroids 2 to 4 days to kick in and work. Pain relief can last for a few days to a few months at a time. With regards to the risks of epidurals, they're small. There can be a risk of infection, some bleeding. You should stop anti-inflammatories about a week ahead of time. Allergic reaction is possible. Steroid side effects, which are typically transient. A nerve injury could occur. It may not work. That's the biggest risk. Complication rates are under 1%. Are epidural injections FDA approved? The answer is no. This is not a bad thing. I mean, 40% of medicine in this country is used for off-label indications. All right, it just means that somebody didn't spend the tens of millions of dollars to get it FDA approved. It's been used for over 60 years for epidural injections, so it's legal, it's often beneficial. Here's 3 examples of medications used off-label: Neurontin, Lidoderm, skin patches, and propranolol for performance anxiety. The top non-operative pain management in Chicago is with Premier Pain Specialists. There are several clinics throughout the metropolitan area, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at ppschicago.com and then call us at 847-519-4701. Thank you very much for watching.